Welcome to GutTalk TV, a YouTube channel focused on closing the communication and knowledge gaps in gut health.
Please see our disclaimer and press the subscribe button below.
Hello everyone, I'm Dr. Jakob.
Hey, I'm Dr. Yoon. We are gastroenterologists from Australia. Today we are going to talk about corticosteroids. Corticosteroids, including prednisolone, prednisone, hydrocortisone, and budesonide, are used in short-term treatment of inflammatory bowel disease. There are many brand names for this medication and many different formulations, whether it's intravenous, liquid, tablets, enemas, and suppositories.
Your doctor has recommended steroids to treat your IBD because you have active inflammation that needs to be controlled quickly. Treatment with corticosteroids aims to rapidly control a flare-up of your IBD and improve your well-being by reducing or eliminating symptoms, including diarrhea, bleeding, urgency, and abdominal pain. Corticosteroids are frequently used to control a flare while a long-term maintenance medical therapy is being established.
The body naturally produces steroid hormone in a low level. Corticosteroids are a synthetic version of these hormones and reduce inflammation. These are different from anabolic steroids, which are used to build muscle.
Corticosteroids work quickly, generally within days, but sometimes takes weeks to achieve full efficacy.
Prednisolone, prednisone, cortisone. This can be taken as tablets or in liquid form. The dose should be taken in the morning. You will generally be started on a relatively high dose and then dose is reduced over time, called a tapering of the dose. It is important to follow the tapered program prescribed by IBD team. Budesonide is an oral steroid which is developed to reduce the side effect of associated conventional steroids because it is mostly broken down prior to getting into the bloodstream. Budesonide works by releasing the medication directly at the site of inflammation in the bowel. There's an enteric coat of budesonide called entercoat or budenofusp. It usually comes in 3 mg capsule. It releases corticosteroid in a small bowel to treat inflammation caused by Crohn's disease. There is a colonic release budesonide, so-called budesonide MMX, or under the trade name Cortimen. It comes in 9 mg tablets. It releases budesonide through the large bowel to treat ulcerative colitis or colonic Crohn's disease. Rectal steroids are used where the inflammation is found in the left side of the colon in the form of enema to target that area or in the rectum only through formulation suppository. Depending on the location of inflammation in your bowel, an enema or suppository may be more appropriate. These are generally best tolerated when administered in the evening. Enemas comes in either liquid or forms. Enema uses a special applicator that is inserted into rectum and can deliver medication up in the colon. Suppositories are solid dosage forms of medication that are inserted into rectum and dissolved over time. Intravenous steroids are generally administered in the hospital for patients who have a significant inflammation and are quite unwell. They are very rapidly acting treatment that requires special monitoring.
Although steroids are found naturally in the body, synthetic steroids are often administered at doses that are much higher than normal physiology. All medications can cause side effects, although not everyone experiences them. You will be monitored for side effects by your doctor and team. More common short-term side effects that you may experience include increased risk of infection, trouble sleeping, acne, fluid retention, a puffy facial appearance, weight gain, mood changes such as irritability or anxiety, growth of facial hair, stretch marks on the abdomen, reduced libido, and high blood sugar levels. Longer-term side effects are more likely to occur when steroids are given at high doses for a prolonged period of time and include increased risk of infection, weight gain, cataracts, poor bone health called osteoporosis, thinning of the skin, problems with blood supply to the top of the thigh bone, muscle weakness, diabetes, and high blood pressure. In babies or children, steroids can be associated with changing growth. After many weeks on high-dose steroid medication, your body produces less of its own natural steroid hormone, and therefore you cannot stop taking the medication suddenly or too quickly. Otherwise, you may become unwell. Symptoms include fatigue, loss of appetite, weight loss, abdominal pain, nausea, vomiting, headaches, joint pains, dizziness, or fever. You should inform your IBD team and doctor if you experience any of these side effects.
Let your treating team know if you are experiencing side effect or think you might be getting an infection. Your IBD team will monitor your response to treatment by tracking your symptoms as well as checking your blood and stool tests, and in some centers using intestinal ultrasound. Blood tests are generally performed to monitor patients while on oral steroids, with the frequency depending on the dose and the tapering regimen.
It is important to be well and stable on medication before becoming pregnant. Tell your doctor if you are thinking of becoming pregnant or find you are pregnant. Your IBD team may prescribe steroids for active inflammation during pregnancy, as there may be a greater risk to the baby if the woman does not take treatment and is unwell with IBD. Steroids are generally considered to be safe during pregnancy and breastfeeding for short periods of time.
I hope you find this video helpful, but if you have any questions, please leave in a comment section below. Thank you very much.